and not obstacles. Good afternoon to one and all present here. I, Sukriti, student of MBA batch of 2021, would like to take this opportunity on behalf of Amity Business School and Amity Institute of Competitive Intelligence and Strategic Management to welcome you all to the guest lecture. The guest lecture focuses on the topic Strategies for Adoption and Success of Telemedicine in Indian Healthcare Technology Domain. We have with us Ms. Kritika Das Gupta ma'am, Head CRC, Amity Business School, Mr. Rajiv Mittal sir, Mr. Arya Kumar Vikramaditya sir, and the faculties of Amity Institute of Competitive Intelligence and Strategic Management. I take this opportunity on behalf of Amity Business School and Amity Institute of Competitive Intelligence and Strategic Management to welcome Ms. Sonia Gupta ma'am, Consultant Marketing Strategy at HealthPrax. Sonia ma'am is a consultant marketing strategy at HealthPrax. She is also associated as a research assistant at the Department of Strategic Management of MICA, Ahmedabad, India. She holds a master's degree in commerce from the Delhi School of Economics and a bachelor's degree in commerce from SRCC, University of Delhi. She has a prior experience as a research consultant at Ernst& Young Global Delivery Services in the cross-sector research knowledge team. She is the recipient of the prestigious Mitsubishi UFJ Foundation Scholarship Japan under by the Bank of Tokyo Mitsubishi in 2016. She has a knack of multidisciplinary is interested in research in on business innovation, consumer behavior, strategic management, and social impact strategy. She is the recipient of the prestigious Mitsubishi UFJ Foundation Scholarship. Japan. She is preparing to begin doctoral studies in marketing and innovation. We will request you, ma'am, to take the lecture forward.
Thank you so much. I would first of all like to thank the institute and the faculty members and the students to be part of this session. And it's a great opportunity for students to learn and grow with the reality checks of how businesses work and operate, starting from the business operations. So I would like to start to present my screen where the students will be able to connect with how things are working. Just I'll do that. Is everyone able to see my screen?
Not yet, Miss
No,
Sonia.
no, Sonia, no.
Yeah, now it's visible.
Yeah.
Yes, it is.
Now it's visible.
So, I would like to welcome you all. I am Sonia Gupta, and I am presenting here the topic Strategies for Adoption and Success of Telemedicine in India, Healthcare Technology Domain. So, as I have already been introduced, I would just brief it up that yes, I gave a consultation for the HealthPrax, which is a upcoming telemedicine company based by Yojda ma'am in Germany. I'm also working as a research assistant at MICA in strategic marketing, as well as a research fellow at Casper India. So I have done my previous studies majorly related to finance, business, marketing innovations, and a bit of the behavior we work on. So here we are with the topic which is very interesting for the students, and they're definitely going to learn a lot about what healthcare telemedicine and technology means. So the takeaways from this session will include what is the meaning of telemedicine, what is the need for telemedicine here in India especially, and what are the previous studies. So this is also a collation of the study that I had done for Health Prax before we started with this organization. So you will be able to understand what different strategies are taken up. And then we can take up the marketplace evidence and the comparative analysis of different firms in India. Then we came up with a framework model, which I have proposed, and it is in evolution, which can help in defining the vision and mission of the company. And then I'll provide a future research direction. So, previously, Miss Anamika had told you about the careers in healthcare and technology innovations and how the graduate students can incorporate it in their lifestyle. So, as per the strategy graduates, now you here, we will go deep into the specific strategies in healthcare industry. So, what do we mean by telemedicine? Basically, providing diagnostic services or personal services which are available from a distance and remote location. It can be either through call, text, or maybe a video from a doctor who is remotely located to the patient who's there in some different city or some different country altogether. So the World Health Organization used to describe telemedicine as a delivery of healthcare services where distance is a very important factor, and all the healthcare professionals using information and communication technologies for the exchange of valid information either for diagnosis, treatment, or prevention of disease and injuries, including research evaluation for the continuing education of health and for individuals and communities. So, after you've understood that what telemedicine is, I'm sure you might be able to relate that how relevant it is right now that we have gone through the pandemic year, the entire 2020 and the ongoing 21 is definitely the need for telemedicine service to rise up to remote locations where it is not available. So my next is why behind the telemedicine? Why do we need telemedicine? So the previous studies have ensured that there are zero point 0.8 doctors available for at least 1,000 people in India, whereas the standard has to be at least more than one for 1,000 people. So India is lagging behind in the provision of doctors for the people in India. Specifically, we are not even having appropriate healthcare expenditure in India for the GDP. So 1.28% of India's GDP is already gone into healthcare industry, which is very less. Apart from that, the studies on telemedicine previously have more or less focused on them as a service, not from business point of view, and especially not in the emerging market context. So this study which I'm going to present and the pointers that I'm going to provide you are going to help you understand what strategies can be there to explore the different forces and factors which are required to adopt and have a sustainable business model in telemedicine in the emerging markets. And you're welcome to ask the questions therefore. So here are the previous studies that we worked on telemedicine business. So I had collated different research papers and survey studies that were conducted in different emerging and developing countries. So as you can see, the first and the second, they were mostly like from BRICS and China, where they could analyze the different strategy and come up with different factors which are required for a telemedicine business. It could be the storage, the connection type, or the technology acceptance of the people, the value proposition of the model itself, what is the partnership of the company with the different companies, the resources which are required, the services, and the customer acceptance specifically in India, because you will agree that we all are used to going to the doctor and telling them our problems and having that faith that yes, they will tell the right disease or the cure or the prevention mechanism. But here, with the remote locations and internet facilities getting increased, so we believe that telemedicine business is the real future in the upcoming healthcare domain. There were different findings in which we could understand that user interface needs to be very easy for the people to explore different continuous use of the telemedicine. Apart from that, accessibility to medical resources is much dependent on what is the geographical location located in the cost structure. The second, the third study that you will come across is from Scott and Mars 2015. It gave ideas about how awareness is important for people to know that yeah, telemedicine services are there. So we came up with actually that we might be using our healthcare doctors or the family doctors and calling them up that oh, this is the problem and how we are dealing with it. But this is a proper business service line that has been expanded by the companies. So people are not aware of these kind of services, especially in rural and remote location. So that is also one of the important things. Similarly, change management, technologically appropriateness, and the kind of resources that we require. And then there's doctors' awareness as well. Not only patient, but also the doctors are not aware of such mechanisms which are available in the different locations in the country. Apart from that, the familiarity with the concept of telemedicine and how it is operated and the technicality of the technology used and how complex it is. So these kind of regulatory frameworks are definitely there. So next we worked on the marketplace evidence, which works on different companies that were engaged in India in telemedicine. So since 2008, there have been upcoming new companies that are taking up and actually they have established themselves well in the market right now. So in our study, I collated the commercial enterprises that are not offering services for free, that they are charging some fee for the services they're providing, and also the virtual consultation services and the practitioners available on online platforms. So this is how the evidence was created. So I'll be presenting the uh, comparative analysis based on the firms. So we considered Practo, Librate, Viro System, Doc Engage, Docs App, MFind, and iClinic, which are some of the top players in India, especially in telemedicine firm and healthcare engagement. So we collated the different information available from their site by using their software apps and from internal data, and we were able to come up with different information from these, that how they are strategically using different platforms. So if we see, not all the companies are available on platforms like maybe Linux or maybe Mac OS. So there are some particular companies which are concentrating on Android customer base, or some are focused on iOS customer base. So there are different ways in which we are focusing on the kind of technology platforms we are using. So a company which needs to come up needs to focus on what platforms they are trying to capture and what kind of customer base they are trying to capture. So we can learn this, that how suitability also matters. So the product they are offering here, you can see that for agency and personal use, some companies are not able to provide the appropriate platform. So I believe that this can be taken as one of the other key takeaway, but we have to focus on the kind of use and the purpose, broader sense, to suit the purpose of the appropriateness of customers and specifically the doctors. Then we came up with the modes of telemedicine. So we have three modes mostly, called chat or video. So chat is also one of the messaging types which we are considering. So there are mostly the companies which are established in India. They're using all these portals and mediums to get to their customers. And also there are some companies which have not started for video, but they have now in the coming days. So we have to take care that we are available on different platforms and the technology is appropriate for the country we are focusing on. For example, for other emerging markets like Pakistan, Nepal, where there are hilly areas as well, and there is a challenge of focusing the technology and the networks. So we need to focus on that sense only. Further, I worked on the revenue system model of the firms that I compared. So in the different organizations, year of incorporation varies. So first was Practo in 2008, and then eventually it was followed by iClinic and Viro Systems and Liberate and many others. Some supposedly the focus areas are different. So in telemedicine, we understand that we can give diagnosis for different areas, like maybe healthcare, doctor appointment opportunity, clinic management help, like patients are incoming and outgoing, the waiting time, the messaging for their next appointment. So these kind of management is required in telemedicine. So I have mentioned the focus areas here, as you can see, CM, MD, and DA, which the full forms are below the table. Like uh, the clinic management services are mostly everywhere present in these portals. Also, the remote consulting, which is the very base of telemedicine organization and the service. And then there are additional services like medicine delivery and healthcare management and lab testing, which are being provided now to add on to the supplement. So we can see that as a company, if we are an analyst or we are giving some marketing strategy idea of how to expand, we need to be very cautious of the area we are focusing on and how established the firm is and how we are deep diving into different areas of healthcare. Then again, you can see the market presence in different cities. So you can see Doc Engage and Viro System are only tier 1 cities, which are the metropolitans and the urban cities. But Practo and iClinic are trying to expand themselves in different countries as well as rural areas and cities. So we need to be very careful of how we focus on which area we choose. It depends on the kind of networks we get, the kind of channels we are able to go through, the kind of customer base we are focusing on, the years of incorporation. So we will be coming up with that in the model. So the business model mostly is B2B, which is business to business. So they are providing, the company is the business which is providing the services to another business, that is a doctor or the clinics. They are not directly going to the customers. And also the technology used is mostly cloud, SaaS, AI, artificial intelligence, and Internet of Things, IoT. And the revenue base varies for different companies, as you can see. The doctor outreach has to be very expensive. So Bracto has been established since 2008, and it has almost 1 lakh doctors on its portal itself, and they're equally earning than 25 million patient outreach, and the revenue is good enough. 15 million for a new company which has come up only like 10 11 years ago is good to go. So the outreach has to be the main crux of the firm that we're working on. The years of funding, the total funding that is received by the company. So as you can see, Practo has received the maximum funding, like $251 million is like very important to expand the outreach. That's why they are able to acquire new firms. They have acquired different companies, services, and offerings to incorporate in their work. So it is not necessary that as a company you need to have your own setup of service line like medical delivery or healthcare. Maybe you can grow as a firm and buy and acquire the other companies which are providing these services. So as you can see, the fee and the cost structure is different for uh, consulting and the clinic management. So it varies between 100 to 400 or 500 for different consultations per consultation. So that needs to be taken care of, that what kind of customer base are we focusing on. So this is the way that we had compared and understood the analysis apart from literature review. So we came up with the different business model framework that can be worked on, which I proposed, that can be the starting phase of a company. So as you can see, we have suppliers, which are the healthcare technology firms, which are going to make the product offering, the hardware and the software vendor, which is going to provide us the software on which we are preparing the product, and the payment channel, which is very important right away, that we have some transaction payment mechanism here in India, so that it's easy to process. Maybe it can be third-party app like Paytm, PhonePe, or we can have our own Paytm payment model. Then, and we have the demand here, which is from the patient and the customers and the doctors who are going to demand the product. And there we have the 6 A's of adoption, where I was able to collate the different A that we require, that people are able to adopt the telemedicine service line. Not only doctors, but also customers, the patients, that is. So first was applicability, that it should be applicable. See, we can't say that we are going to do a heart surgery virtually right away. The technology is growing. It is possible in the future with the upcoming times. But currently, we are only focusing on non-complicated consultations and the follow-up cases where we can maybe diagnose or prevent a disease, that kind of thing. So appropriateness is the next thing, that it is appropriate for the customers. The target customer has to be appropriate. If you're focusing on rural, then the advertisement, the marketing, the expansion technique will vary accordingly. And similarly, the location and the technological availability there, whether they have the setup or not. So I will give you an example, a very beautiful example, I believe. So Doc Engage did a very thorough study, and they tried to expand in rural areas in India. So they realized that people might not even be having a smartphone for an internet call, right, in rural areas. So what they came up with was that maybe they can provide a phone number, and then people can call, and that will be teleported to the call center, which will allocate a doctor to the person, and they can maybe tell about their problem and the symptoms, and the doctor can provide them a bit of the idea. So this was taking away a major part of their time, but the complication occurred about the payment. People can definitely call and take the consultation services, but how does the company receive the payment in exchange of the services? Like without internet, without any location, what to do? So our customer themselves suggested that we can have mobile recharge, which can be done, and they will recharge the mobile like normal old times, and the company can maybe convert it into money. So this gave a really good idea to Docking Age, and they were able to connect with different telecommunication companies like Vodafone and Airtel, and they had a system where people could recharge a particular phone number, and that money was converted for revenue within the company. So there is no technology involved as such, but the solution was so simple. It was in front of our eyes, but we do not realize it. So that's the kind of target we need to understand that India requires or other emerging countries require. Similarly, the accessibility is the next A of adoption, like proper technology and telecommunication, the facility of infrastructure. Otherwise, it's going to be very difficult to penetrate into the market. Next is awareness, which is very important. The awareness among the public sector, especially the patients who are in the suburban locations or rural locations, they're not really friendly with the kind of uh, portal this is, and the kind of technology savviness is a big time challenge. They face that maybe this is complicated for them. They might not be preferring this kind of services. So this is the job of the company, that they need to ensure that there is literacy about the people and the familiarity, and there is awareness about the brand. And this works most through word of mouth in India. As we know, we locate in close societies, we take validation from our own friends and neighbors, and it is the best marketing strategy that can work on, especially in rural areas with Anganwadi workers and self-help groups, where people can say that yes, we use this telemedicine services where there is online product and we can use it. And then next is accessibility. Acceptability. So acceptability is majorly about that yes, we are aware about the product, we are aware about the services, we are aware about the business, but do we accept it? There are barriers in the cultural norms that we have, that no, we are not okay with a doctor maybe seeing our privacy issues, or some religious habits or social habits that they have which resists the change. So that's where the adoption part lies, that people have to have an experimental attitude. They need to be ready for the change that is coming up, and they need to be willing to not only use but also tell about it with everyone. Similarly, we have the last adoption A, which is attractiveness. So the ease of adoption will create the attractiveness that they prefer it. The cost price, which is there, the privacy issues and security that needs to be ensured, and the perceived benefits that will come out of it. So these are the emerging strategy for markets in India and other emerging countries, which can be taken up, which will lead to a future direction, as you can see, which will take us to growth and sustainability. What can be the future ways? As commerce students and MBA students, you all must be going through the challenges where the companies are asking you that what are the growth and sustainability opportunities? How can a company expand themselves? So we can come up with three main things that are coming up, especially with the financial soundness and value proposition and the disruptive innovation. So financial soundness mainly focuses on the revenue and the cost that it is being maintained, that the company is able to get the grants and funding apart from the income from services. And then the value proposition, that can be the USP of the company. See, these services can be provided with by any company, right? Then how is your company different? So maybe I'll give an example of Doc Engage that they did. Another example of another company which is coming up, Karma Healthcare, is also taking up this initiative where they're setting up the centers and providing the technology required, and people can come there and have the remote consultation with a doctor. So similarly, Health Prax is also trying to provide this kind of initiative, and the upcoming chartered plan is definitely going to be to incorporate and cover the larger customer base that we have in India, in the semi-urban and the rural. That is also a part of the disruptive innovation in us, where we focus on the market and the technology. The market cannot, like, it does not need to be the urban areas where the smartphones are available and customers are more maybe literate and aware about it. It can also be the rural areas and the semi-urban areas which require that kind of familiarity. There has to be a start, right? And another market can be B2B markets and hospitals, where the hospitals are providing those kind of services. And the boundary conditions, that means the moderators that can impact the growth and sustainability, and they need to be in the favor, are the three: regulatory mechanism, basically the rules and regulations in India, maybe that what are the telemedicine practices in a particular country. Then the government support, the kind of support in the way of business, ease of business and the technology incorporation. Apart from that, the partnerships and collaborations of a country. So if a company is able to collaborate with different partners and endorse itself through different strategies, they'll be able to come up with a different growth and sustainability pattern. So this is the kind of idea that we had in mind when we started with Health Tracks as well. Although this is an evolving project for us, and this is how we have to start with the factor analysis, in the way that people are able to understand that yes, this company is for us, to us. So the future research direction in which research can be done, or maybe you can explore, or you can give an idea to another company when you go in the job market, is what are the country specific advantages that play a role in a sustainable model. That supposedly, if you say India is a labor rich country, so we can use them for the helpers and the nurses, right? We can train them well. So these kind of advantages need to be researched properly in the telemedicine industry. And apart from that, what are the influencing factors and different conditions for different locations in India or other emerging market? Other question that can be, what is a shift in perception about the potential customers in emerging markets that affect the sustainability of a telemedicine model, and the dormant market opportunities which are lying there apart from the limitations. And we can have the different business platforms that can be exploited further. So we can think of that. So these are the references that I used in my research. There are more, but these were the core references that I've used even in my literature review. And I would like to mention that with this understanding, it will be easy for you to understand how a company begins its research, the basic research of how they start with it, how the strategies need to be incorporated. They have a baseline of how they go ahead. And that's the mission and vision that HealthPrax has, to digitize the setups by emerging markets and have a trusted and prominent health tech organization to the overall domain. And the objectives which are aimed at simplifying the streamline of the clinic management and the patient data for the small industries and the small setups which are not able to manage their own things due to lack of expertise or maybe lack of understanding of technology. So thank you so much. I would like to have any questions if you have, or any queries.
Any questions, students? Please raise your hands and you can ask the questions. Can we see the raise of hands if you have any queries?
I hope it was pretty clear and it was not that difficult to understand and to analyze how a company works and how a company thinks broadly. I would really like to have a question answer round if you have anything, or else we can connect later as well.
Sonia, can you give one or two tips to the students, who would like to go into telemedicine or who would like to have a startup of their own on this line? So any two, recommendations that you would like to, give to them?
Sure, ma'am. So, students who are planning to have their own venture or maybe get into the industry should definitely have an idea of the on-ground realities of the business and the healthcare. It's the mixture. You can't work on a secluded self, right? So the first thing that you need to work on is understanding how businesses work. There is a need in the market, or there might not be a need in the market. You need to create a need in the market sometimes. So till now, telemedicine was not really understood as something needed, but now with digital healthcare and the uncertainties in our lifetime, it has come up as a necessity. It is out of option now. So that kind of need needs to be there. Apart from that, how to monetize it, what kind of monetizing mechanism needs to be there. And then you have to think about the offering that you're providing to the customer. Do they ask for some kind of service, or is it a product, or is it a mixture? So you need to think very well that how you're working on it together. Apart from that, you need to have a bit idea of how healthcare industry works, of what are the different stakeholders that are related, what are the normal perceptions and stigmas that people have usually. So customers might have different problems of not sharing their personal information with the doctor on screen because they have a fear that it might be recorded, right? So that kind of insurity needs to be there, that you are following the guidelines. Specifically in India, it's a it's a very different thing in a way that developed countries already have rules and regulations, but developing countries are still having a hold on this area. So In fact, in the, I guess in March or April only, India came up with its own guidelines of telemedicine services. Before that, there were no guidelines or services. So what happened was a couple of challenges for the companies as well as the customers. So there's another telemedicine company called NetMeds, which used to provide online medicine delivery and also doctor consultation. So since there were no particular guidelines or rules that were dictating the working of a business, they had set up their own chemist shops, offline chemist shops across India, because there was no challenge and there was no problem in it. But there were other chemists and neighboring companies that questioned it, that no, this is not possible, this is not right, because maybe this is not ethically right, or this is not being taken permission for. But the company clearly says that there are no guidelines. So these kind of things need to be taken care of before you enter into the market, so that you're not committing the kind of mistake that you can't take back. So there are huge risks involved, right? So these kind of things need to be taken care of, and especially it'll be helpful for you to note from the mechanism that I shared and the framework that I shared, that what are the various points that you need to checklist on, what are the things that you need to take care of. Anybody else?
Any further questions, please? Okay, Sukriti, can we just
Sure, ma'am. With this, we come to an end of our event. I would first like to express my sincere thanks to Sonia ma'am, who has taken out time from her busy schedule and enriched us with her immense expertise and knowledge. I would also like to thank our faculty coordinators. This event will not have been possible without the presence of our students. Thank you so much, ma'am.
Thank you so much. It was really nice interacting. And it's okay. People can connect with me on LinkedIn, and also come to the Health Tracks website. And we have different opportunities for students, and they can fill up the forms and we can connect with them later. And it would be great to connect with them eventually in the different industry that we're working on. So it's a vicious cycle. It's a circle that we are working on. So definitely it'll be great if we are connecting, learning, and sharing. So all the best to everyone.
Thank you so much, Sonia. It was really a pleasure having you.
Thank you, ma'am. Thank you.
Thank you, Sonia ma'am. Thank you.
Thank you, sir.